Welcome to the 2022 annual community briefing for the Hazelwood Health Study. I'm Michael Abramson from Monash University. I'm the principal investigator of the Hazelwood Health Study. It's my pleasure to introduce Sue Yell, who's from Federation University and leads the community wellbeing stream. And I guess Sue will also introduce her colleagues to you.
Hi everyone, good to be here to give you an update. Yeah, I lead the community wellbeing stream, so we are based out of Federation University, but we have colleagues at multiple sites now. So Matthew, whom you all know, and also Michelle Duffy, formerly of the Churchill campus at here in Gippsland, and also Damien Morgan, also formerly based in Churchill, both moved on to other positions but continue to be keenly involved in the community wellbeing stream. And also our RA, who is Dr. Lisa Walker, who is also locally based, trained at Federation University, and a Morwell girl, I might add. So the community wellbeing stream has been tracking the community's wellbeing and recovery since the mine fire in 2014, but obviously a fair bit has happened since then. So we've broadened the scope of our work to look at the impact of other major events like the closure of Hazelwood, obviously the Black Summer bushfires, the COVID-19 pandemic, and there have been other things too that have been significant, and some of them have had either positive or negative impacts. So we want to take all that into account in looking at community wellbeing. We're also supporting the work of the psychological impact stream, and we're looking, teaming with them to look at the relation between community wellbeing on that kind of collective level and individual wellbeing on that more personal level. The work that we're doing on community wellbeing includes both a subjective and an objective perspective. So we're interested in how the community perceives itself, but also about what statistics say about the community's wellbeing, looking at objective data. So that might be things like stats on access to health services, employment figures, crime rates, rates of voluntary work. To understand how this community perceives itself from that subjective angle, we've been conducting interviews. So about a year and a half ago, we did interviews with 30 community members and key stakeholders. And we're very grateful to those people for their time. We're also following local media and social media to understand the issues of concern that are being raised there, but also the things that this community is proud of, positive aspects as well. And we're gathering data from the mental health and wellbeing follow-up survey that was conducted by the Psych Stream back in early 2022. And in that survey, there were questions about subjective aspects of community wellbeing. So how people think community wellbeing is going. And we're currently analysing the information from that survey. To understand the community wellbeing from a more objective perspective, the stream's been working on developing a tool that we call a community wellbeing barometer. And this aims to measure community wellbeing using objective indicators taken from publicly available data sources. So surveys and data that's already collected by other organisations, so including things like the census and various Vic Health surveys. We then compile this data into graphs that show changes in community wellbeing over time. So this is a graphic representing the 5 elements of the community wellbeing barometer as we've developed it so far. So we talked to our interviewees about what they thought were the key aspects of community wellbeing, what are the things that really impact on community wellbeing, and came up with these 5 domains. So services, infrastructure, social connections, the environment, the economy, and health. And then within each of those domains, we've broken them down into a number of themes. And then the final step was to identify objective indicators. As I mentioned, these bits of data that can be collected from existing surveys and that can be measured. So we're using those to indicate changes over time in each of the themes. So there might be an improvement or there might be a decrease in levels of community wellbeing against each measure. And when we put all of this information together, the aim is to map communities' resilience and wellbeing across time and try and correlate that with significant major events. So our next step is to take the barometer and the information we have so far back to our key stakeholders to test its accuracy and validity, to kind of check with them, well, given what they know, they're more, close knowledge of the community, to see if that sort of tallies with how they see this community travelling. And ultimately, once we're satisfied with how the barometer works, we aim to share it as a tool with any other interested organisations who think they could use it for their own purposes in how community wellbeing is travelling. It's particularly designed for this community in Latrobe, but it could be applied in other communities as well. Early next year, we plan to conduct another round of interviews with our stakeholders and community members to go back to them and ask them if their perceptions of community wellbeing have changed at all since we last interviewed them in 2021. And then we'll put all of these data sources together, so what the barometer is telling us, what our interviewees are telling us, what we're seeing reflected in the media and social media data, and also the survey data, to give us a more complete picture of community wellbeing, including what makes this community resilient, as well as its areas of vulnerability. And finally, we'll continue to look at impacts on older people and what we can learn from our elders. Age continues to be one of the key factors considered in the analyses arising from the upstream areas. So that's it from our stream.